That said, do bear in mind the top 3 most common side effects of fillers are not vascular occlusions or blindness, but 1. Bruising and swelling at the injection site, tenderness or discomfort at the injection site, which is usually mild and temporary, or lumps and bumps under the skin when the filler is injected too superficially. Hi everyone, I'm Dr. Stephanie Yang, an oculoplastic surgeon and medical director of Eagle Aesthetics and Surgery. Filler injections are a popular cosmetic procedure used to address signs of aging, such as fine lines and wrinkles, as well as to add volume to areas like the lips and cheeks. While these procedures are generally considered safe and complications very rare, they do come with certain risks and potential complications that patients should be aware of. And these include infection. Anytime a needle or cannula is used to inject a substance into the skin, there's always a slight risk of infection, although very rare. Proper hygiene and sterilization practices can help reduce this risk. Another possible risk is allergic reactions. Some individuals may be allergic to the components of the filler material, which can lead to allergic reaction. It's important to discuss any known allergies with your doctor ahead of time. Other potential risks include bruising and swelling. Bruising and swelling are common side effects of filler injections, particularly in sensitive areas like the lips. These side effects usually subside within a few days to a week. The patients may experience pain, discomfort, or tenderness at the injection site. This can usually be managed with over-the-counter pain relievers and should resolve relatively quickly. Lumps and bumps. Occasionally, filler injections can result in lumps or bumps under the skin. This can often be massaged out by the practitioner or may require additional treatment. Overfilling or underfilling. Achieving the desired results with filler injections can be a delicate balance. Overfilling can lead to an unnatural appearance, while underfilling may not achieve the desired improvement. Another potential risk is that of migration. Filler material can sometimes migrate from the injection site to other areas of the face, causing asymmetry or other unintended effects. Nodules. In some cases, filler material may lead to the formation of nodules or granulomas, which may require further treatment. Last but not least, vascular complications. In very rare cases, filler injections can inadvertently enter blood vessels, leading to complications like skin necrosis, also known as tissue death, or when it happens in the eye, lead to vision problems, or in the worst case scenario, blindness. Filler complications, including blindness, have been discussed ad nauseum in oculoplastic conferences for many years. As ophthalmologists who do a large volume of aesthetic work, we are particularly careful about anything with such risks. The classic theory of filler blindness has been injection of the filler into the vessel lumen, and the column is injected retrograde, travels retrograde to a point proximal to the artery's origin at the ophthalmic artery, then propelled distally along the ophthalmic artery itself or into the central retinal artery, causing sudden vision loss. However, recently, experts, and we credit Prof. Daniel Rootman for this, feel that empiric evidence and experience are discordant with this theory. You need extremely high forces and large volumes to be able to do that. The alternative and more plausible theory is that of embolism. When injection of small amounts of filler is injected into the vessel lumen, the collateral flow is towards the orbit, and hence the embolism is injected anterograde. So what does this mean if the alternative theory is correct? It means it's a numbers game. The more you do, the higher the risk it might happen one day. It can happen to the best injectors, as it's not a matter of skill, but a random mingling of rare events with rare predisposition, or just plain unlucky. It can happen to the best of us. All things considered, filler and other injectables are generally safe and effective. That said, do bear in mind the top 3 most common side effects of fillers are not vascular occlusions or blindness, but 1. Bruising and swelling at the injection site, tenderness or discomfort at the injection site, which is usually mild and temporary, or lumps and bumps under the skin when the filler is injected too superficially. There are precautions we can take when mitigating the risk of filler complications. First, patient assessment. Before performing any filler procedure, doctors should conduct a thorough assessment of the patient's medical history, including allergies, prior cosmetic procedures, and any medications they are currently taking. This information helps identify potential contraindications and assess the patient's suitability for the treatment. 2. Informed consent. Doctors should educate patients about the procedure, potential risks, and expected outcomes. Informed consent ensures that patients are fully aware of the treatment and its possible complications. 3. Hygiene and sterilization. Maintaining strict hygiene and sterilization practices is crucial to prevent infection, so doctors should use sterile equipment and clean the injection site thoroughly before the procedure. Product selection. Choosing high-quality, FDA-approved filler products is essential, so doctors should select fillers based on the patient's goals and the area being treated. They should be familiar with the properties of various fillers and their potential side effects. Next, injection technique. Proper injection technique is vital to ensure accurate placement of the filler and minimize the risk of complications. Doctors should have a deep understanding of facial anatomy to try to avoid blood vessels and certain dangerous zones like the glabellar region. Some doctors also feel that cannula use is safer than needles as they are less likely to puncture a vessel. However, this is debatable even among experts, with some feeling that sharp needles give better control and are less likely to introduce material tangentially along the course of the artery. Aspiration. For certain areas, doctors may use an aspiration technique to check for blood return before injecting the filler, thereby reducing the risk of vascular complications. Again, this is debatable, but some doctors do it as added precaution. Importantly, we should be prepared for emergencies. While rare, complications can occur, so doctors should be trained to recognize and manage potential complications promptly, such as vascular occlusion, by using hyaluronidase to dissolve the filler material if necessary. Do bear in mind that hyaluronidase works only for hyaluronic acid or HA fillers. With the increasing use of polymers in the market, we need to be extra careful. Continued education. Doctors should stay up to date with the latest techniques, safety guidelines, and advancements in the field through ongoing education and training. For myself, in addition to the above, I take extra care by using fillers only if essential and in very select candidates. I also avoid high-risk zones, especially the glabellar region, and I'm very careful about not overfilling. In my practice, no one gets more than 2 syringes at any one sitting. I also like to inject very slowly and in small volumes. I also advise patients on their range of options and offer other non-filler options like other types of injectables, skin boosters, energy-based devices, and surgery. Patients who have undergone a filler procedure should be vigilant for any signs of potential complications. While complications are relatively rare when performed by experienced professionals, it's essential to be aware of the following signs. Number 1, severe or prolonged swelling and bruising. Some swelling and bruising are expected after a filler injection, but if it is severe, persistent, or worsens significantly after the first few days, it could indicate an issue. Number 2, pain or discomfort. While mild discomfort is common, persistent or severe intolerable pain at the injection site should be reported to your healthcare provider. Number 3, redness and heat. Increased redness and heat at the injection site may indicate inflammation or infection. Number 4, lumps, bumps, or irregularities. If you notice the development of lumps, bumps, or irregularities at or near the injection site, especially if they persist beyond the initial healing period, it should be evaluated by your practitioner. Number 5, changes in skin color. Unusual changes in skin color, such as blanching, which is whitening, or bluish discoloration, can be a sign of vascular complications and should be addressed immediately. Number 6, vision changes. In cases of filler migration or vascular complications around the eye area, patients may experience vision changes such as blurred vision, double vision, or partial loss of vision. This is a severe complication that requires immediate medical attention. Numbness or tingling. Persistent numbness or tingling at or around the injection site should be reported, as it could indicate nerve involvement. Number 8. Skin necrosis. Skin necrosis is a rare but serious complication in which the skin tissue dies due to compromised blood supply. It may manifest as black or darkened skin. Seek immediate attention if you suspect skin necrosis. Next, allergic reactions. If you experience itching, hives, or swelling at the injection site, or other signs of an allergic reaction, such as difficulty breathing, do seek emergency medical care. Number 10. Unintended cosmetic changes. If you are unhappy with the cosmetic results or notice asymmetry, discuss your concerns with your practitioner. They may be able to adjust or dissolve the filler if needed. It is essential to maintain open communication with your healthcare provider and follow any post-procedure instructions provided. If you notice any concerning signs or symptoms after a filler injection, do not hesitate to contact your practitioner promptly. Early intervention can often prevent complications from worsening and ensure your safety and well-being.